Welcome to Chapter 17 on sudden illnesses. This is a long presentation, so I broke it up into parts. So this is part 1. It'll go through the first 15 minutes of the presentation, and then you'll get part 2. So Chapter 17 is broken up into, I believe, 4 parts. Be sure and use your book as a resource with this chapter as well. So an easy way of explaining changes in responsiveness is by using the mnemonic STOP, S-T-O-P. S stands for sudden illnesses such as sugar, sugar that's too low, seizures, stroke, and shock. The T in STOP is temperature. The person could have gotten overheated, or they could be hypothermic, very cold. O refers to oxygen. Inadequate supply of oxygen could be related to asthma, anaphylactic shock. And then the P is poisoning or pressure on the brain. So just kind of know what these 4 letters stand for, and it does help you to determine unexplained changes in responsiveness. So this is a review of what we've kind of already gone over in the first chapters of the book involving cardiac arrest, how to handle it, first aid. But just as a reminder, a heart attack is considered whenever the blood supply of the heart is cut off. It can be called a myocardial infarction. Some people like to sound very medical and use that term. It can also be caused by arteriosclerosis, where you get the fatty platelets that kind of start to coat the arteries, and it causes them to close down or diminishes the pathway for the blood to flow. So as a review, remember, heart attack is one or more of the arteries becomes clogged or blocked. That is a heart attack, a heart that's it's under a lot of pressure, the blood's not flowing out it very well. Whereas cardiac arrest, either the heart stops beating completely or the lower chambers suddenly develop a irregular type of motion as opposed to the rhythmic, lub-dub. They start to quiver. Remember, the two shockable rhythms are ventricular fibrillation and tachycardia. Because a heart attack is a sudden illness, it is again reviewed in this chapter. So just as a review again, signs and symptoms of a heart attack: chest pain, sweating or cold sweats, lightheadedness, dizziness, nausea or vomiting, pressure on the chest, numbness, aching and tingling down the arm. Also remember, in women, they sometimes feel it in their jaw or their back. Shortness of breath, weakness, and fatigue. Again, reviewing what to do in the case of a heart attack. If you suspect one or more of those symptoms add up to someone suffering or getting ready to suffer a heart attack, have the person sit still, stop what they're doing. They can raise their knees up if it's comfortable. Don't put them in an uncomfortable position where their breathing's compromised. Call 911 and loosen any tight clothing. Reassure the victim and tell them that help's on the way, and remember, don't give them anything to eat or drink. If the person does take medication, usually it's nitro. If you know the person, you know that they take nitro, you can help them take it. Usually it's placed under the tongue. Sometimes they have other means of getting it through or getting it into their system. If they're alert and able to swallow and not allergic, you can help them take aspirin. Remember, they have to be alert, they have to be conscious, and research has proven that aspirin does help to prevent heart attacks or diminish the heart attacks when they start to happen. So if you do give them the aspirin, be sure and tell EMS, hey, I gave them aspirin, so that they know you did. Always monitor the breathing until help arrives. Angina is the term used to medically describe chest pain, and usually it's chest pain that results from blood flow that's restricted at the heart muscle but not completely blocked. The arteries become narrow. So sometimes you'll hear people call heart attacks angina, that are suffering with angina, but sometimes it's not as it's a temporary angina. It's not like where the plaque is really constricted into the blood vessels or anything. So when some of the reasons that the arteries can't carry sufficient oxygen could be, excessive physical exertion. They could have overdone it. They could have decided, I'm going to go out for my New Year's workout and I haven't worked out in a year. So that could have caused a little bit of angina. Excitement, they get overexcited about something, emotional upset or stress. Sometimes eating a heavy meal can cause angina. If they're out in the heat or the cold too long, they can suffer some chest pain, and cigarette smoking has been proven to cause some sort of angina as well. So drugs that can be given to an individual or prescribed to an individual who has a problem with, their arteries constricting, when they get overexcited or anything, are vasodilators. Vasodilators are coronary vasodilators. They're medications that help to open up the arteries so they don't constrict so much and so readily. And nitroglycerin. Nitroglycerin is used for patients that have had heart attacks before, or sometimes they've had surgeries or any type of illness that has caused the blood vessels to constrict in the past. They might get nitro just to make sure that they stay open. So angina, what to look for? It's the same as if you're looking for signs and symptoms of a heart attack. It can spread to the jaw, arms, mid back, last more than 3 minutes and maybe 10 minutes. And oftentimes, if they have immediate relief after being administered nitroglycerin, then you know that it's been an angina. Stroke is life-threatening. It is the medical condition when there's a sudden interruption of blood flow to the brain. It's either caused by a block or a rupture of the primary blood vessels, or even some of the smaller blood vessels in the brain. All the effects, because of the lack of blood flow, the brain cells are not getting the nutrients, so most of the effects are permanent. When you do have a lack of circulation in the brain, parts of the brain do die, and they die pretty quickly. There are two types of stroke, ischemic and hemorrhagic. Ischemic occurs when the blood vessels become narrowed or clogged with plaque. There isn't any blood flow out around the brain. It's all blocked. It isn't a rupture or anything. Hemorrhagic occurs when the blood vessels rupture near the brain. Transient ischemic attack, TIA, occurs when a part of the brain is deprived of oxygen-rich blood long enough to cause symptoms, but not long enough to cause permanent damage. This is something that for some reason, the artery becomes blocked. And again, it's not a long-term blockage. It's not a rupture. It's not something that's completely closed off the artery. It's a temporary constriction. It resolves completely within about 12 hours. So this very attractive photo is to help show the signs and symptoms, what to look for when someone's suffering a stroke. You can use the mnemonic FAST, face, arm, speech, and time. Face, you want to check if the face one side looks lower than the other. Arms, ask the victim to raise their arms, and if you know that both arms are, move normally, and one arm is dropped lower, or one arm they're not even able to raise the left arm or the right arm, then you know there's a problem. Ask them to repeat a sentence to you. The green tractor in the grass looks pretty. And then ask them to repeat that, and that is part of the speech. If they can't repeat it, or if you're not sure if it's the way they normally talk, if it's a stranger, and they're slurring and stuff, consider, if you have the other two, that they might be suffering a stroke. Then the last thing is time. You want to write down the time that you noticed that this person was suffering with the signs and symptoms of a stroke. What to do for a stroke? Call 911 immediately, monitor their breathing, position them on their back if it's comfortable. If their breathing becomes labored, leave them where it's most comfortable. Loosen any tight clothing. And if they start to vomit, you got to be prepared to put them on their side if they are on their back, just so they don't aspirate on their vomit. There's not a lot you can do other than calm them, reassure them, make sure 911's on the way, keep them warm, and treat them for shock. Asthma is a breathing-related illness. It's chronic lung disease that inflames and narrows the airways. It reoccur when it reoccurs. It's usually induced by exertion, excitement, but some of the signs and symptoms include chest tightness, shortness of breath, and coughing. This chart is just some more common triggers of asthma. The most prevalent ones I went over. Look this chart over. I'm not going to go into it in a lot of detail, but just know that there are environmental reasons that cause asthma. Cold air. Sometimes pollen causes people to go into asthma. Drugs or chemicals. Aspirin sometimes causes people to go into asthma attacks. Occupational exposure to chemicals. Lifeguards, for example, are around a lot of chlorine. It might cause asthma in them. Conditions and events can also cause people to go into asthmatic issues. The allergic reactions, sometimes gastropharyngeal reflux, which is acid reflux, and then exercise. What to look for if you think someone is suffering from an asthma attack: frequent coughing and wheezing, chest tightness, shortness of breath. Sometimes they'll sit down in a tripod position because it kind of relaxes the diaphragm a little bit. Inability to speak complete sentences. They might be really breathy. Their nostrils might be flaring. They may elicit fast breathing and heart rates. And if they go for a minute or two, you'll start to see their lips turn a little bit blue, and their fingernails, the capillary refill is going to be diminished as well. So what do you do in this situation? You want to have the person rest in a comfortable position. You want to have them relax their breathing, breathe deeply and slowly. Call 911 only if the person is struggling to breathe, talk, or stay awake. If they do start to become cyanotic, blue lips and fingernails, capillary refill is diminished. If they don't have any inhalers or any medication to take to alleviate the attack, or if they just outright ask, I need an ambulance. What to do if the person does have medication. You ask them where it is. Make sure when you do get their inhaler that it has the right date. It's not expired. It is theirs. It's no more sharing of inhalers. And it's the right dosage. So it should say on there what the dosage, if it's 1 hit or a 2 hit type of vial. Help the person use the inhaler. Don't actually puff it into their mouth, just hold it. Have them actually use it. Tell them to breathe in deeply. If they don't improve, you need to call 911. If they have repeated attacks, call 911. And if it's one that isn't relieved by the inhaler, make sure the EMS is on the way.